Roxanne Wilder with you. We are at one of the 4 pediatric locations of Watson Clinic. We are here in Lakeland at North Pediatrics. I am so happy to be joined by Dr. Velez as well as Dr. Cornett. Great to see you both today. Thank you.
Nice to see you as well, Roxanne.
We are talking about a very important subject. Parents want to know more about this subject, so it's very topical. Let's talk about the importance of vaccines.
One of the most important things that we do every single day, just keep our kids healthy, prevent serious diseases, and really try to, keep our community as well as our individual patients very, very healthy.
Absolutely. Do you have anything to add to that?
I think it's just important to prevent what you don't see that we have seen and that may not be on the forefront of people's minds right now regarding the diseases, but used to cause a lot of nasty things.
Right, right. It's evolution, technology. It's basically helped us in medicine. And so let's discuss safety of vaccines because, of course, parents are talking about their children, their prized possession. What can you say about the safety of vaccines to parents who are concerned about those types of things?
I think there's been plenty of studies, many studies across the board for many years now, for several decades, that have shown that vaccines continue to be safe and effective for children. And this is why we continue to follow the guidelines set forth by the American Academy of Pediatrics and the American Committee on Immunization Practices on the safety of vaccines. And I feel like we've had enough data over several decades that show that we really can feel safe in saying that they are safe and effective for our patients.
And what about some of the vaccine schedule? What's the recommended vaccine schedule?
So I think when you go by the American College of Immunization Practice, the AAP, the CDC, the schedule that's been around for a very long time, it's been tested back and forth as far as the safety, the timing of the schedule. I think what's important to understand about the schedule is that the earliness and the timing of the vaccines, the way we give them and the amount we give, is because this is when infants are so vulnerable. So some parents are like, oh, can we wait? Can we not do so many at this time? Can we do them at a later time? But starting at 2 months when we do them is when you're most vulnerable, when these things are so serious and can be deadly at times. And so the other thing I'd say about the safety is that unlike any other drug, not only prior to going to market vaccines, which usually are over years of time, but then after they're on the market and being given, they're even post marketing are studied, scrutinized to see if there's anything potentially, probably the most scrutinized drug we have.
That makes sense. Okay, I'm enjoying getting to know the two of you off air and your great chemistry here at this practice. And I really have a soft spot in my heart for pediatricians. I have young kids right now. So why is it that you both decided to go into this line of medicine or area of medicine?
I've always enjoyed kids since I was a little girl. So I knew I really wanted to taking care of kids. And I feel like with kids, they're so resilient, even when they're sick as stink. They will come in here, they'll give you a smile, they'll play with you. The parents will be super worried, and then you look at the kid and he's smiling and he's laughing, and I just say, okay, yeah, he's sick, but he's just, being plenty of laughing and everything. When it comes to adults, not so much, maybe a little bit more cranky. Yes. So I much more enjoy the kids than the adults.
You can't give an adult a sticker and they can't get better. So that's probably number one. You don't have to grow up.
Right.
I think honestly, it's more the evolution. Like you have these parents on day one of an infant. They're scared to death. They don't know what they're doing. They're panicked, deer in the headlights. You get to see that evolution, and then you wake up and they're graduating high school. So it's very cool.
That's a beautiful thing. I never thought about it that way. Plus, you get this beautiful backdrop in the office with the fish. It's like we're in an aquarium right now. So great meeting both of you today. We're giving our viewers the information right now on the screen so they know about those 4 locations, those 4 Watson Clinic locations. You can take a look there, visit the website. Thank you so much, Dr. Jason Cornett, Dr. Kendra Velez. We appreciate it.
Thank you so much, Roxanne. Appreciate it.